Now, also, as you know, we've had a few patients recently have some brachioplasties and things done.
Right.
The difference on those, now, I know some of them do lipo and some we do an actual brachioplasty. What would determine the difference
Okay,
between
when you
those?
say brachioplasty, for those that are listening audience that might not know exactly what we're
Right.
talking about, brachium refers to the arm, specifically that part of the arm that goes between the shoulder and the elbow. So that's the arm. And the brachioplasty is a procedure that's utilized to remove the excess fat and specifically the hanging skin that occurs, between the shoulder and elbow. That can be quite disconcerting to women who have been successful in losing weight or who haven't and just want smaller arms because it's hard to find blouses, it's hard to find clothing, and it's just difficult to be comfortable with these big arms. And so I would say most of the time I'm doing an actual brachioplasty where we're removing skin. And after I remove that skin, I like to send them and have them be seen by the radiation people, and they help make that scar not become a big, raised, thick, ugly-looking thing. So that's the combination that I most commonly recommend. Once in a while, if a person does not have an excess of skin, but they just got big, sort of fatty arms, a liposuction will work. Rarely I'll do them both together. This week we did a case where
that was my
both.
next question. Would you do both together?
We did lipo and the brachioplasty on both arms each arm. Yeah.
Right.
So, but that's a little less common. Yeah. So.
All right.
Yeah, but those are good questions.
Great.
Yeah, there are things that are perhaps worth mentioning. Primarily so that I can suggest that the buyer beware. There are some things that have surfaced and have resurfaced in the area of body contouring that may not be the best idea. One of the things that has resurfaced is this external ultrasound. Now, I'm not going to suggest that a person is going to get hurt by having external ultrasound on a fat area to make it smaller, but I'm not convinced that it's very effective. I mean, external ultrasound is only going to penetrate for maybe a centimeter or two beneath the skin surface, and most fat deposits are much bigger and deeper than that. So you're really not going to get a whole huge amount of benefit from external ultrasound alone. So I would suggest that the buyer beware of that. The other thing is, a while back, mesotherapy was a popular option, and that's a matter of having various medical or pharmaceutical compounds injected into the fat with hopes that it's going to melt the fat. Right. And it would melt the fat, but again, this is not a reliable, easily controlled process, and so people would end up with lumpiness and irregularities, and so they were unhappy about that. And it can also produce some scarring, which makes liposuction or reparative procedures later a little bit more difficult to do. And thirdly, and in the same vein, this laser liposuction is also a thing that buyer beware, be real careful, because it's only in the hands of very, very talented and experienced people that results are consistent. I mean, we've seen several patients that have sustained burns and this kind of thing, and you just gotta really know, you really have to have a sense that your doctor is experiencing these kinds of things, and that these are medical procedures that are safe most of the time. High percentages of safety. One of the things that's coming down the pipe that I find very interesting and fascinating is a body jet, which is a power water spray assisted liposuction device, which we're actually going to be testing in the office next week, as you know. And we've seen some really good reviews about that. Some very credible people that I know, my colleagues that I know to be, very diligent, have had good things to say about it. It's a little slower. It's just much slower process than standard ultrasonic or tumescent liposuction. But it is a technique that and a technology that appears to have a great amount of promise and a very low incidence of doing harm. And that's what we have to be real careful about, that we don't hurt anybody when we do these
Right.
things.